I think that the expectation should be the exact opposite for clinicians online. I would argue that clinicians are probably going to be some of the least nice people online. Now, to be fair, plenty of clinicians online are perfectly nice. They're perfectly thoughtful, caring, funny, loving people. And so there's nothing quote unquote wrong with your therapist if they're sometimes an asshole online, or if they're sometimes mean, or they're a dick, or they make bad jokes or cruel jokes, or whatever. Whatever the reason is, your therapist is not under any special pressure to be quote unquote nice online, because we are not acting. Our ethics code does not transfer to social media, right? If we are being our regular selves, if I'm just like Patrick Lockwood on Twitter, for instance, which I am, I'm a Lobha Patrick, which means non-attached Patrick on Twitter. I'm not acting as Dr. Lockwood on Twitter. I'm acting as Patrick, me, the regular person. Now, I can't just like take off the jacket, so to speak, and be not Dr. Lockwood. I always have that connotation. I always stink of Dr. Lockwood online. But the truth of the matter is, I'm also allowed to be a regular person. There's this inherent duality that every mental health professional, every healthcare provider, unfortunately carries everywhere they go, which is they're always a regular person, and they're also, unfortunately, always a professional. But to be clear about our ethics code, what it says, we're not acting in our professional role. No healthcare provider should be acting in their professional role on social media, on personal social media.